The race online to secure a COVID-19 vaccine is leaving many seniors behind. Bloomberg News reports that the online process to make appointments is especially frustrating for elderly citizens lacking the computer skills or familiarity with smartphones to sign up. And it could get worse as more slots open up for younger people. Dina Bass is a tech reporter for Bloomberg News, and she is with us now to break this all down. We've been hearing more and more about this problem, and I think about my own parents, and my mom's, pretty good on the computer, but I can never reach her on her smartphone because she doesn't use it. She doesn't see a purpose for it. She hardly ever turns it on. My dad's kind of the opposite. He's not a computer guy, but he is on his smartphone. Can you tell us about some of the seniors that you spoke to for this article? Who's struggling? How are they struggling? What are the issues that they're encountering?
Sure. Thanks for having me. So it's basically a lot of what you're saying. In order to get these coveted vaccine slots, you have to go through a disparate, disconnected set of websites, frequently by refreshing at odd hours of the day to see when appointments, drop into the website. You often have to give your cell phone, your smartphone, so that you can accept text messages. And a lot of the people that we spoke to didn't have regular internet access, or if they did, they knew how to get their email, but they weren't able to get through all of the different sets of websites and keep checking them at different hours of the day. We spoke to people with vision problems. I saw you just put up Tom Yates. So Tom is somebody that's based in Washington State. He's 71. He has cancer. He uses a wheelchair, and he has blindness. So he had sort of the perfect storm of things that were making it difficult for them. He said he couldn't really see the websites well enough, and he couldn't drive very far because he uses sort of a dial-a-ride, an access-a-ride service. And that was what we heard from people. In the most extreme cases, there are seniors that we spoke to that don't even have email. And in order to sign up for these shots, you have to be able to be contacted by text message or by email. And so we were finding that the system, which was digitally heavy, was really leaving behind seniors. Many areas have dial-in numbers, toll-free numbers, things like that, but those phone lines are very overloaded, and so people couldn't get through on them.
So what happens to those who can't rely on family members to hunt down appointments, or who may be scared of using technology and the potential scams that come with it? Early in the pandemic, I did a story on a young man here in New York City. His name was Jordan Mittler, who had started helping members of his synagogue to get onto Zoom. Because if you recall, like Zoom, no one knew what Zoom was back in February and March, and all of a sudden we're all using Zoom. But grandparents who were missing their children or their grandchildren or grandkids weren't able to connect with them because they just didn't know how to use it. And so now I can only see it being worse now that you have to figure out how to use your computer for vaccination testing. So what can be done?
And that's what's going on. People are volunteering to help other people. For the story, we spoke to someone in New Jersey who was putting up flyers in her town offering to help. One of the people that I spoke to for the story who had helped his parents has since used that experience to set up a service in his church to help other people. And that, it ends up with individual Good Samaritans and volunteers making up the gaps. The other thing that we found that was really challenging for seniors was getting to, for people who have mobility challenges or can't wait for a while for their appointment, there was a much smaller subset of appointments that they were able to get to because they couldn't drive themselves. They couldn't go somewhere an hour away and wait. And that was also really limiting for them. So you wound up with a situation where the most vulnerable seniors were and the ones with illnesses or the ones who couldn't drive were really the ones being left behind. And as I mentioned, volunteerism is getting through that. States and counties are trying to add more phone help, but there's still not enough to meet the need.
Yeah, you talk about volunteers here in Pennsylvania. Somebody set up a Facebook page called a PA COVID matchmaking site with the idea that, if you have maybe an elderly relative living somewhere and they need help with the guiding them through this whole process, maybe they can figure out a way to match people up and help people. And I'm just reading sort of one of the posts here on that site, and it says, I have registered on so many sites, I can't even remember them all. I probably duplicated. I've had no success. Where is my guardian angel? Like, it just sort of strikes me as so disappointing that there are people out there sort of grasping in kind of in the midair of the internet, hoping that someone will help them, when this should be really a process that is very well organized way ahead of time. And the struggle sort of represents a bit of a shift from the first wave of the vaccinations for healthcare workers. What are some of the factors that are contributing to the confusion around the vaccinations?
So I think for healthcare workers, it was more contained. Most healthcare workers were getting their vaccine in the hospital or facility they worked in. I know in New York City, hospitals volunteered to be sites for individual doctors' offices that had to come in. But it was this more contained group of people, mostly getting it at their workplace. This is completely different. I think a challenge for seniors is that one of the messages we and their doctors were telling them in the run-up to all of this was, you will hear from your doctor or call your doctor. But doctors' offices don't have the vaccines. And so seniors are finding that even if they can get through on the phone, the answer that they're getting in many cases is go online. We spoke to a 91-year-old Korean War veteran in Florida, and he and his daughter were trying. They got a hold of the VA, the Veterans Administration. They got a hold of the state vaccination hotline, and all they could tell them was that he had to get online at 5:45 a.m. twice a week on the website for Publix, the supermarket, which was handling the vaccine appointments for his area in Florida. And that was difficult for him. He tried it one morning, but he couldn't get an appointment. And he wasn't set up to keep trying that. Now, since we ran our story, people saw his name and someone reached out and helped him. Same with the person that I mentioned in Washington State, the 71-year-old cancer patient. Someone saw his name and helped him, but that's not scalable. Publishing an interview with everyone having a problem and having someone individually call them is not a scalable system. And as you mentioned, what happens as we open up to younger? So there's already been something of an issue as some states have moved down to 65 plus. Some of the folks who are 65 plus are more computer savvy and are more mobile. And so they can sometimes take more of the appointments or have an easier time. As we move into younger groups, this is going to continue to happen. And there's also a worry, as you were discussing in your previous segment, of, if this relates to internet access and computer access and having good broadband, it also leaves behind people in both urban and rural areas that don't have that. You mentioned in your previous segment, racial disparities. There's a racial component to that as well. If your ability to get a shot relates to your ability to have the kind of internet access or the kind of time in your day where you're not working, where you can go online over and over and over again and hit refresh on a number of different sites, that's going to leave people out.
So the article cites AARP New York, which found almost 60% of nearly 3,000 people surveyed failed at getting an appointment. I mean, what does this say about the demand there is for vaccines?
So, and that's a major part of this as well. We have to acknowledge that some of what's going on is not just failures in the system. It's that there are far more people that want a vaccine than can get one right now. So demand continues to be high, and that will start to ease, although, not as much as we need as more vaccines roll out. There's expected to be an increase in what states are getting. So that will help. But we also need to reckon with how we get to people who can't use computers, and also how we get to the homebound. And that's time consuming and it's slow. And that is also an issue. You're showing photos now of seniors waiting in line. If someone cannot wait in line for hours, and many of these areas have long lines and no bathroom facilities, so that's a challenge. Some seniors are completely homebound. And so certain areas are starting small pilot projects or small projects going door to door for homebound seniors. Miami Beach, which has a huge senior population, has had its fire department going door to door. Last weekend here in Seattle, in one of the neighborhoods with a heavy Somali immigrant population, there was a small clinic set up for elderly folks in the Somali community who have both technological and language barriers. And as part of that clinic, which also used nurses and volunteers from the Somali community so they could talk to the elders and explain to them what's going on and what they needed to do. Part of that project also went door to door for a small number of people who are homebound. And as we try to have a full rollout here, that's going to be necessary for some of our seniors as well. It's not just computer skills.
All right. Dina Bass, thank you very much for your reporting. Really insightful. Thank you.
Thank you for having me.